So today is a very important lesson. The goal of today's discussion is to know your medical providers. There are so many different levels of providers out there, but I think it's important that you know who you are talking to and what they can actually do for you. So we're going to start down at the lowest level of education and go all the way to the top. So who can give you prescriptions and who cannot? Who can actually pass them out? Who can prescribe? So when you walk into an office, the person sitting at the desk very likely is a medical assistant. This person did get some education, not necessarily college. It's probably, some people will probably say like a technical degree. So they went to maybe a 1 year, possibly a 2 year technical college. They probably know how to draw blood. They took some technology or medical terminology. They probably maybe know some billing or things like that. They're usually your medical receptionist. They can do some procedures, but they have to function under either an LPN license, an RN license, or physician, or maybe a nurse practitioner, physician assistant. Okay, so the next person you may see in a doctor's office or nursing home, or usually your one passing the medications in the nursing home is your LPN. They tend to do a lot of I'm going to call it the grunt work. They are your backbone a lot of times. They're doing a lot of the work that you see in the facilities, in the hospitals. They are, usually a 2 year degree. They are a lot of times the face. They do a lot of the hard work that's out there. So the LPN and the medical assistant are a lot of times the ones that you're seeing doing a lot of the work. Then you have your RN. Now it's kind of fading out, but they can have a 2 year degree, but most of them do have a 4 year degree. A lot of them are bachelors. Some of them do have a master's. So your RN has a higher level of degree. They do take a more specific test than your LPN. So your LPN is doing a lot of your grunt work and a lot of your everyday hard work. Your RN is a lot of times in your supervisor positions, but again, they are on the floor. They might be doing a lot of the floor nursing. They might be doing more of your injections in the offices. They can do Jeuveau, they can do IVs. So they're doing some of that grunt work as well, but they are doing sometimes a little bit more specific stuff. So your RN does have a higher level of degree. So again, it's your medical assistant, your LPN, and then your RN. So those are your level of education degrees. So your RN does tend to have that higher degree, and your RN with their bachelor's and master's usually does tend to get into your supervising roles. So up next is your physician assistant. Now your physician assistant sometimes can have their beginning degree. They actually can have their beginning 4 year degree in sometimes a non-related medical degree, and then they decide to go into medicine. Not always. A lot of them do have a beginning physician or medical degree. So say maybe they decided to do intro to medicine. They decided not to go all the way through medicine. They just did an intro to medicine. Then they went to physician assistant. So there's some types of medical degrees they can do. Maybe they started out in physical therapy, then they decided to go to physician assistant. So they do have a 4 year degree, but then they stepped into physician assistant. Okay, nurse practitioner, I'm going to kind of jump on this a little bit. So a nurse practitioner starts in nursing school. They have to get their 4 year nursing degree before they can go to nurse practitioner. I want to make that very clear. So a nurse practitioner is a nurse first. Physician assistant doesn't necessarily have to have a medical related degree for their 4 year degree before they go to physician assistant school. So that's a big difference between those two degrees. Now let's talk about licensing. So once they receive their license, your physician assistant, they're a nurse practitioner. So I am a nurse practitioner, so I am going to be a little bit biased, and this may cause some controversy, but open it up for discussion. I'm more than happy. I've actually been a nurse practitioner for 19 years. I've been in the medical field for 30 plus years. So bring the comments. Very good. Love it. Let's do it. So nurse practitioner, I am very holistic in my approach to care. You come in talking about your finger, I'm going to ask you, how's the family doing? I'm going to look at the finger, but of course I'm going to be more concerned about, okay, Oh, you bent your finger? How'd you bend your finger? I'm going to be more intrigued about what's going on all around, not just the finger. Or, okay, you have high blood pressure, but what else is going on? So there's going to be more digging that's going on. Where the physician assistant may be more, they might be more intrigued because as a mid-level, and yes, we don't like that term, but that's a lot of times what we're called as the mid-level, because we're not the doctor and we're not the RN anymore. We're the mid-level. So as that mid-level, a lot of time we may get a few more minutes with you in the office, but we get a few more minutes, but sometimes that physician assistant might not be able to have as much time as that nurse practitioner. But they're in a supervisory role under physician, where a nurse practitioner might be in Ohio. I'm in a collaborative position where I have a physician I have to call, where they have a supervisory role where that physician, they function under their license. So they might be more direct in, oh, your finger hurts, let's worry about your finger. Where I might be more worried about, oh, your husband bent your finger. Okay, now we have more that we need to worry about. Where that's a little bit different in what our approach is, where I'm more holistic and more worried about the whole picture, where they're going to target in and hone in on just that finger. So I am able to go out and start up my own practice and be under my own roof, where the physician assistant may have a harder time doing that. I'm not saying they can't, but they're going to have a harder time doing that. So nurse practitioner tends to have the ability to go out on their own, which I have done. And I've actually been doing now for 16 years, 15, 16 years. So I love being a nurse practitioner, but I'm not saying it's bad being a physician assistant. They just have a little bit more restriction. So now let's talk about DO versus MD. I personally enjoy going to DOs because, again, they have a little bit more open mind. But MDs are great as well, but they have just a little bit different training. The DOs have more of an osteopathic way of looking at things. So they have just a little bit different training, where the MDs kind of go through the surgical rotations. They have just a different kind of mindset a little bit. So it's all in your preference, where, what you want and what you prefer. So the DOs have a little bit more time with you, it seems, where the MD might be a little bit more technical. But they're both fantastic and they both do a great job. I'm not bashing either one of those. I think they're fantastic groups of people. So let's talk about the chiropractor. This is a bonus. The chiropractor can be great. They have a completely different mindset. I go to one. I think she's fantastic. I love the way that she looks at the world, and her glasses are totally different than the way that I look at the world. I would say her view on the world is very similar to my view on the world versus the way maybe an MD looks. Her view on the world is probably closer to the way a DO looks at the world. But, they can't prescribe. They have to have a relationship with a nurse practitioner or maybe a PA, but not typically. I don't think I very often see PAs in the chiropractic world. It's more the nurse practitioner, because they do have a more in line relationship and mindset. So if you're going to a chiropractor and you're expecting to, receive medications other than vitamins or supplements, they have to have a relationship with a medical professional, licensed medical professional, such as a nurse practitioner or a physician. They cannot prescribe without one of us. So you need to make sure that they have a licensed professional within their practice. Make sure you're questioning your provider. I always say you guys are your own advocates. You need to educate yourself, and you need to know who you're seeing and who is taking care of you. That's your job. Ask questions. Thank you. I hope you feel educated. Since you made it to the end of this video, I know you like the content. Subscribe for more.